Hello and welcome to another live broadcast with MedStar Health. My name is Mishan Carter, and I'm excited to be here as we dive into an important and often overlooked topic, maternal stroke and stroke risk factors, especially during pregnancy and postpartum. Stroke is a leading cause of serious long-term disability, and understanding how it can affect pregnant and postpartum women is critical, not just for healthcare providers, but for their families, communities as well. Today, we're honored to be joined by two incredible experts. I have Dr. Sujithra Jayaraj Sudarsan, Chair of the Department of OBGYN at MedStar Montgomery Medical Center, and Abby Butler, Perinatal and Neonatal Director at the Maryland Institute for Emergency Medical Services Systems. They'll help us understand what stroke is, the different types of stroke, the warning signs that we need to look out for, and how women, especially during and after pregnancy, can lower their risk for stroke. We'll also be taking your questions, so feel free to share those in the comments, and we'll get to as many as we can today. So let's get started. Thank you both for being here. To kick things off, could you introduce yourself and share a little bit about what you do with your patients? I'll start with Dr. Jayaraj.
Good afternoon, everyone. My name is Dr. Sujithra Jayaraj Sudarsan. I'm chair of OBGYN department at MedStar Montgomery Medical Center. I lead 7 OBGYN physicians and 2 nurse practitioners. We have a very dedicated service to our prenatal moms, both normal pregnancy and high-risk pregnancies. And our labor and delivery unit provides very personalized care for all our pregnant moms, excellent nursing team who recognizes the warning signs for strokes or any other medical emergencies. We do gynecological surgeries, including robotic surgeries. So we are a well-rounded OBGYN practice. We are located in 3 locations, Gaithersburg, Silver Spring, and Albany.
Thank you very much for joining us today.
Thank you. Thank you for inviting me and having me here.
Of course, of course. And Abby?
Yes, hello. My name is Abby Butler, and I am the Director of Perinatal and Neonatal Referral Centers for, like you said, the word salad, which we call MIMS, Maryland EMS systems. And I really work closely with our hospitals that are level 3 and 4 perinatal and neonatal referral centers. So any place where in the state where you would land if you were going to be a high-risk pregnancy or have a complication with your newborn are the hospitals that I work with. So I'm actually a nurse by background, by trade, and I have worked in obstetrics and the neonatal field for about 13 years now.
Awesome. Awesome. Thank you again for joining us today.
Thank you so much.
All right, so let's get started with some questions and get a little bit of background on stroke. So Dr. Jayaraj, could you share exactly what happens during a stroke and what makes strokes so scary?
Certainly. A stroke happens when the blood supply to the part of the brain is interrupted or reduced, preventing the brain tissue from getting the oxygen and nutrients it needs. The brain contains little or no energy stores on its own, so therefore it relies mainly on the blood flow for their survival. Without the blood flow, the brain cells begin to die within minutes, which can lead to permanent damage or even death. Strokes are so scary because they can have devastating and long-standing consequences because the brain controls both our body and mind. The potential outcomes are physical disabilities, such as paralysis, weakness. It usually happens on one side of the body, making walking, using arms, or performing daily activities difficult. And it also affects the speech. The survivors may struggle to speak clearly, understand others, read or write. There are also cognitive impairments, such as memory loss, difficulty thinking, reasoning, making judgments, and understanding concepts. There are also emotional and behavioral changes, difficulty in controlling emotions, depression, anxiety, irritability, and personality changes. The other difficulties are swallowing, which results in choking and nutritional problems, pain and sensory changes such as numbness, tingling, or chronic pain. Vision problems, including blurred vision or double vision or even blindness. And of course, last but not least, very increased risk for death.
And could you share what are the signs and symptoms of stroke? I know I've heard of be fast, and I think that sounds a little bit familiar to everyone. Could you share, break that down for us and share why is it important to get to the hospital as soon as possible?
Perfect. BFAST is actually a very helpful way to remember the key signs and symptoms of stroke. It's easy. B stands for balance. If you notice any sudden a loss of balance or coordination. E stands for eye, trouble seeing or double vision or blurred vision or even loss of vision. F stands for face, face drooping on one side. So if we ask the person to smile, you could see one side of their face droop down. Arm, weakness or numbness of the arm. So if we ask the person to stretch the arms, one arm will start drifting downwards. And then speech. If person known to you or even person who you don't know, if they are slurring or difficult to understand them, that's one of the signs. And time is the essence. We need to, it's very important to call the emergency service immediately. So getting to the hospital as soon as possible is critical if you or someone you know has any of these symptoms because time is brain. As I discussed before, it's the interruption of the blood flow to the brain. And the ischemic stroke, the blood flow is blocked, or in the hemorrhagic stroke, where the blood vessels burst and the bleeding happens, the brain cell starts getting deprived of oxygen and nutrients, and the cells start to begin die within minutes. So the longer the brain goes without blood supply, more blood cells are damaged, leading to more severe and permanent disabilities. Prompt treatment can significantly minimize the extent of brain damage, which in turn reduces the severity of long-term disabilities such as paralysis, speech problem, and other complications. So every minute counts during a stroke. The sooner the medical help is received, the greater chance of preserving brain function. So do not hesitate to call 911 if you suspect a stroke. Don't drive by yourself. Don't ask someone to drive. Call 911 because the paramedics are trained and they will start treating during their way and they will take you to the right place.
Thank you very much. Very important information. I know you mentioned the different types of stroke. I know you mentioned ischemic and hemorrhagic. Could you share the differences of those? What causes them? Any symptoms for ischemic and hemorrhagic stroke?
Abby, is it you or I mean I can go on or if you
Uh,
want.
sure, yeah,
Okay,
that's okay.
okay, perfect. So ischemic stroke is the most common type of stroke. It happens in 87% of the general population. As I told you before, it occurs when the blood vessels supplying the brain becomes blocked, cutting off the oxygen and nutrients. The causes of ischemic strokes are thrombotic stroke. Thrombus is a blood clot. So, blood clot that forms within the artery inside the brain that is already narrowed by atherosclerosis or plaque buildup. So, the thrombus, the blood clot forms within the brain artery. That's the first cause. The second one is an embolic stroke. The blood clot forms somewhere else in the body and it travels to the brain. And it happens in heart attacks, atrial fibrillation, or any heart valve disease. The third cause is hypoperfusion. That's a rare case, but the stroke can occur when there is a decreased blood flow to the brain that could happen from severe low blood pressure, significant blood loss from delivery or postpartum patients, or from a heart attack where there is no blood pump to the brain, or severe dehydration that could happen in heat strokes. Again, the symptoms of ischemic strokes, it always goes with the B fast. If you notice sudden numbness or weakness of the face, arm, or leg, trouble speaking or understanding speech, trouble seeing, trouble walking, dizziness, or sudden severe headache with no known cause.
Thank you very much. And now I'll turn to Abby. Which type of stroke is the general population more likely to have, and what about pregnant and postpartum women?
So imagine I could complete the hemorrhagic stroke before that
Oh,
question.
sorry. Sorry about that.
That's not. So the next type of stroke is the hemorrhagic stroke. It occurs when the blood vessel in the brain bursts, causing bleeding in and around the brain. So this bleeding damages the brain tissue by increasing the pressure inside the skull and, of course, blocking the blood. The causes for hemorrhagic stroke, the number one cause is the high blood pressure. So already chronically elevated blood pressure weakens the blood vessels, make them very easy to rupture. Aneurysm, it's a weakened spot in the artery that bulges and bursts, leading to hemorrhage. Atriovenous malformation, it's an abnormal tangle of blood vessels that can easily rupture. Head trauma, more common in younger individuals or after falls. When a person is on blood thinners, that makes the blood very easily, when it bleeds, it easily spreads. And if they had any bleeding disorders like hemophilia or low platelet counts, thrombocytopenia, they are more risk for hemorrhagic stroke. Drug use, cocaine or amphetamines, they can cause sudden spikes in blood pressure. Sometimes they could cause a vessel rupture and cause the hemorrhagic stroke. Same thing, same symptoms, again, be fast, but in the hemorrhagic, they complain of severe sudden headache, worst headache of my life, nausea, vomiting, confusion, loss of consciousness, seizures could happen, more common in hemorrhagic strokes.
Thanks for breaking those down for us, Dr. Jairaj.
Thank you.
Thanks. Turning to Abby, which type of stroke is the general population more likely to have, and how is it different for pregnant and postpartum women?
Yes, it's very interesting because in the general population, we see that there is a much higher incidence of ischemic stroke and a lower incidence of hemorrhagic stroke, which is great for the general population because the hemorrhagic stroke ends up being a longer road ahead of the patient after it happens. We have a higher chance of actual death and then a higher chance of long-term mobility issues and impairment from a hemorrhagic stroke or the bleed when compared to the ischemic stroke or the clot that we can treat more readily. In the maternal population, though, it's more like 50% and 50%. So we actually see a much higher chance of our maternal population having bleeds than the general population.
Interesting. Interesting to know. Thank you very much, Abby. At this time, I'd like to pause and welcome our viewers again. Thanks to everyone for tuning in. In honor of Stroke Awareness Month, we're talking all about strokes, the different types, their risk factors and warning signs, and a commonly overlooked topic, maternal strokes. This topic is very near and dear to my heart as I'm approaching my third trimester of pregnancy. So if you're like me and you want to learn more, keep watching. Share this Facebook Live with your friends. Share any questions or comments below, and we'll get to as many as we can today. Let's get to a few of my questions, a few more. I'll direct this to Dr. Jairaj. Could you share what is maternal stroke?
Maternal stroke is a stroke that occurs during pregnancy, childbirth, or the postpartum period. It's a high risk for the first 6 weeks, but it could span up till a year after the delivery. It's a rare but serious medical emergency and significant cause for maternal morbidity and mortality. As Abby said, it's more common with hemorrhagic stroke, which has more morbidity and mortality. Stroke in pregnant patients can be ischemic, hemorrhagic, or cerebral venous sinus thrombosis, where the blood clot forms inside the venous system. That's common in malignancy where the blood clots form very easily. So that's also very common in maternal stroke. So, what are the risk factors or causes for maternal stroke? The hypertensive disorders, conditions like gestational hypertension, which is hypertension during pregnancy, preeclampsia, which is hypertension in pregnancy plus protein leakage in the urine, and eclampsia, which is a severe case of preeclampsia where seizures happen. So these are characterized by very high blood pressure, and they can damage the blood vessels very easily and increases the risk of bleeding and clots. So during pregnancy, there is a physiologic change. There are normal hormonal and hemodynamic changes, such as increased blood volume, increased cardiac output, and a hypercoagulable state. It's an easy tendency for blood clotting, which is actually a very good factor because after delivery, that's a change that helps in controlling the bleeding. But paradoxically, they can also increase the risk for stroke. Any pre-existing conditions like chronic hypertension, diabetes, migraines, heart disease, kidney disease, blood clotting disorders also increase the risk of maternal stroke. And pregnancy-specific condition, amniotic fluid embolism, where the amniotic fluid enters into the blood vessel, that also increases the risk for maternal stroke. The other small factors are older maternal age. They say there is no direct cause, but it also puts women at higher risk. And C-sections, mainly because after C-section, the mobility kind of gets a little bit decreased compared to vaginal delivery. And of course, that increases the risk for blood clot formation and leading to the stroke. Not for all, but if someone has a high risk factor, then it adds up to it.
All
Yeah,
right.
exactly. I was gonna
Great.
say
Go ahead.
pregnancy's like the perfect storm, unfortunately. Of
Yeah.
we've got all of these risk factors in the general population of just diabetes and high blood pressure and all of these things. And what do we see in pregnancy? We see all of those things increase. So it's just kind of, the perfect storm, unfortunately, for your risk factor for stroke as well.
Yeah. Yeah. It's a very vulnerable period too, in
Right.
terms,
Yeah.
psychologically, physically, all of that. So a lot to consider, as you're approaching
You're right.
pregnancy,
Yeah.
preparing for it, if you are pregnant. So all very good information to know ahead of time. The sooner the better. Let me go back to Abby. Could you share a little bit of the signs and symptoms of maternal stroke and share what scan me means?
Yeah, absolutely. So we've got the mnemonic of be fast, which we have from an EMS perspective and from a general health population's perspective, had a big push into the public. And most people are pretty aware of be fast and the signs and symptoms of a stroke. In the maternal population, we actually have an additional mnemonic, which is spells out the letters or spells out the word scan me. And in the presence of a headache, in our maternal population, so either in pregnancy or a year after delivery, if we have a patient that presents with a headache and they have any of these signs and symptoms, we want to be thinking about getting a scan. We want to be thinking about getting brain imaging to see if we've got a stroke in this patient. And the S stands for sudden, severe, or seizure. So sudden and severe is talking about that headache. If Dr. J. Raj mentioned it's like thunderclap headache. She said it at the beginning, is that headache where it comes on so fast and it's so severe that it's crippling. And even in patients with a history of migraines, they say this is the worst. This is worse than a migraine I've ever had, or it's the worst migraine I've ever had, and it comes on so rapidly. Or if the patient is having any seizure activity as well, we're going to be looking to get a scan on that patient and get some brain imaging. The C is the change in position or quality. So if we have a headache that's worse, if you are sitting up and gets better when you're laying down, if it's changing the way when you are changing your body position, that's something we want to consider as well. Any altered mental status, which should be a huge red flag in this maternal population, because we're not talking about elderly people. We're not talking about super young. We're talking about, a population that should generally have an intact mental status. It should be coherent when you're talking to the patient. So any altered mental status in this patient population, huge red flag. We're wanting to get a scan on this patient. Any neurological deficits or nausea, vomiting, both of those are the N's in the scan me. So any neurological deficits, any of the BFAST symptoms that we're looking for, or any nausea, vomiting, big red flag. And then medications without relief is the M. If the patient has taken, if they're in pregnancy and only be able to take Tylenol, if they've taken Tylenol and it hasn't touched that headache. If they're postpartum and they can take ibuprofen or Tylenol and it hasn't touched the headache, a huge red flag. And then the last one we've got is elevated blood pressure or temperature. So we're thinking about hypertension or we're thinking about infection with those. If either of those are elevated, again, we're wanting to get a brain image on these patients.
Thank you very much.
Yeah.
Wanted to go back a little bit about the traditional risk factors, and we can delve into the pregnancy specific ones as well. So, Dr. Jayaraj, could you share what are those traditional risk factors for stroke?
Yeah. The traditional risk factors for both general population as well as for the pregnancy one. The first and foremost is always hypertension. So very important to have to control or keep it under control. Heart disease, such as atrial fibrillation, heart attacks, coronary artery disease, or heart valve disease. Diabetes mellitus, when they have higher risk for blood sugar imbalances that eventually lead to the blood vessel damage. So they are easily prone to either clot or to rupture and have a hemorrhagic stroke. High cholesterol and lipids, high levels of bad cholesterol can cause the plaque buildup, which is called atherosclerosis, which narrows the arteries and then increases the risk for blockage. A history of transient ischemic attacks, TIA, is a very high risk factor for future strokes, for future full strokes. Obesity, it increases the risk for high blood pressure, diabetes, high cholesterol, increasing the stroke risk. Sleep apnea, repeated pauses in breathing during sleep can lead to high blood pressure and increasing the risk for stroke. And certain blood disorders like sickle cell anemia, polycythemia, high red blood cell count can increase the risk for stroke. And then the lifestyle factors, smoking, nicotine and carbon monoxide in cigarette, they damages the blood vessels, increase the blood pressure, and make the blood more likely to clot. Unhealthy diet, a diet rich in saturated and trans fats, cholesterol, sodium can contribute risk factors to the stroke. Physical inactivity, lack of regular exercise could lead to high blood pressure, high cholesterol, and diabetes. Excessive alcohol consumption, illicit drug use, stress, and depression are also the risk factors for stroke. And the non modifiable risk factors are age. The stroke increases, of course, with age, doubling each decade after age 55. Race and ethnicity, African Americans have a little bit higher risk stroke than Caucasians. And sex, stroke is common in men at younger ages, but more women die from stroke overall. And with certain female specific factors like birth control pills, pregnancies, increase the risk for women. And family history of stroke increases an individual's risk, and previous stroke is a major risk factor.
And how does that differ for anyone going through pregnancy? I know you mentioned pregnancy, being on birth control, any other pregnancy related risk factors to be aware of?
Yeah. Again, even in pregnancy, hypertension causes the first risk factor for the stroke, mainly the risk of preeclampsia, which is very high blood pressure combined with protein in the urine, eclampsia, which is seizures, occurring in a severe preeclampsia patient, and HELP syndrome. HELP syndrome is a part of preeclampsia, which is a little bit more severe than severe preeclampsia before eclampsia. It involves breakdown of red blood cells, elevated liver enzymes, low platelet count. So whenever we recognize women with these risk factors, we immediately treat them and bring the blood pressure to the reasonable level and take care of all the comorbidities so pregnant women doesn't get to maternal stroke. Previously, we used to say swelling is a normal part of pregnancy, don't worry about it, but not anymore. Like if they see any unusual swelling, even after delivery, on my postpartum discharge instructions, I tell them, yes, swelling is normal, but if you feel like your leg is twice the size, don't hesitate to call us, come in, we'll check your blood pressure. It's a very simple thing, check your blood pressure. If it's problematic, we'll treat you. If not, we'll send you home. Um, and then gestational diabetes, again, same thing. It puts us a risk for high blood pressure and stroke. And as I was telling before, pregnancy is a wonderful thing. The changes that happens during pregnancy is very protective. The hypercoagulable state, where the tendency to form blood clots or the clotting of the blood, it prevents excessive bleeding. But at the same time, if you have any underlying condition, it could increase the risk for stroke. Same with the postpartum period. The first 2 weeks are very riskier, and then, of course, it spans throughout the first year of post delivery. And then the postpartum hemorrhages, like when we are on the floor, we see blood very common. When people from other floors, when they come, they are really scared even at the sight of blood. For us, 200, 500 is very common. So there are situations where we may lose 2 liters of blood, 3 liters of blood. So when that much bleeding happens, it automatically decreases the blood flow to the brain, causing the ischemic stroke. So these are the major risk factors. And the last but not least, not very common, but when it happens, it's a very severe medical emergency, amniotic fluid embolism, where the amniotic fluid goes into the blood vessels and it could block the blood vessels anywhere in the body. So these are the risk factors for maternal stroke.
Thank you. This next question I want to direct to the both of you. So when are pregnant and postpartum women at the highest risk? I know you mentioned that first 2 week period after delivery, and it extends to that first year postpartum. Could you elaborate a little bit more on that? I'll start with Dr. Jayaraj or Dr. Abby. Take your pick.
Abby, if you want to go, we're in.
Okay, great. Sure. Yeah. Yeah. So during the pregnancy, so we've got the first, second, and third trimester. So the third trimester is really where we're seeing a lot of, we're really ramping up the changes. And as a mom, you really start to feel it then. And so Dr. J said, the swelling, we really get the swelling going in the lower extremities, which is all, we're thinking about how the blood is moving throughout the body for stroke. And really, so we've got a lot more blood in the lower extremities that isn't moving that well. And we're not moving that well. And as well as the hypertension. So we're getting the circulatory system, the blood moving throughout the body is really under a lot of stress. And we know that in pregnancy, our blood volume, how much blood we actually have in our entire body, goes way up because we have to compensate. When we deliver, we're going to lose, like Dr. J said, we're going to lose maybe a liter or 2 or 3. So our body gets ready for that. And so we're under this extreme pressure. We've got way more blood than we're used to. We've got swelling in the lower extremities. We've got a lot of weight in our abdomen that we're carrying and putting pressure on places that wasn't used to getting pressurized. And so all of that really just comes together. And we have that in the third trimester. Then we have delivery. and we have got this huge flux of all sorts of changes throughout the body. And what comes with that is also changes in our blood. We know that we lose a amount of blood and our body's prepared for that. But there's a huge change that happens during delivery. And then she said, like she said, the first 2 or 3 weeks after delivery, we're just kind of normalizing. Our body's saying, "What in the heck just happened? Let's like regroup and survive." And so all of that, everything is so in flux with hormonally, and just all of our body systems are just reacclimating. And so that's really the peak incidence of stroke for moms, is when we see that. But then also, we're wanting to collect information, and we're wanting everyone to be super vigilant and hyper aware of this for a year after delivery. We want everyone that to be the first thing that people are thinking of for the year after delivery. And that's why we're including that in this talk, because really the third trimester through delivery is the peak time, but we're at a higher increased risk for a whole year after. And we don't want that to be dismissed.
All right, thank you. We're getting a few audience questions. Let me go up to the first one that I see here, and this is connected to those risk factors. This one comes from Abby. I'm sorry, from Veronica. She mentions, Abby, that you shared that there's a 50-50 chance of either the ischemic or hemorrhagic stroke. Could you elaborate a little bit about that 50-50 chance for women?
Yeah, absolutely. Right. So in the general population, it's about 85% of the clot and 15% with a bleed. And that's great because we know bleeds are more severe and more long-lasting effects. But with the maternal population, that during pregnancy and then a year postpartum, it's 50-50, right? So we've got half of our patients that have a maternal stroke are having a clot, and half of them are having a bleed. And it really comes back to those risk factors that we talked about, and how it just happens. We have more bleeds within the general population because we've got so much pressure and so many things happening to our vascular system. The way that our blood flows throughout our body, that it's very susceptible to breaks in the system. Basically, is what a hemorrhagic stroke is. So that's why we're more susceptible to that. Yeah.
It's like the blood pressure related issues causing the hemorrhagic stroke, that's 50%. And then pregnant women are more prone for blood clot formation and the hypoperfusion from the severe bleeding that could cause the ischemic stroke.
And related to that blood pressure, we have an audience question from Candace. What is considered elevated blood pressure during pregnancy, and when should it be a concern?
So the elevated blood pressure is the cutoff for normal blood pressure. Anything above systolic, the top number above 140, and the diastolic, the bottom number above 90, will be seriously looked upon. That does not just one reading. We give a time for moms to monitor at home. Um, this is considered the first step, like giving close monitoring. But any blood pressure, systolic above 160 or the diastolic, the bottom number above 110, that's a very high blood pressure that we call it a severe range high blood pressure. So that will be immediately looked upon, treated upon, or at least checked upon at the hospital, and we'll continuously monitor, and if treatment is necessary, we'll treat them.
I have a couple more. I just wanted to add these audience questions in. This one comes from Kelsey. Should pregnant women who are homogeneous or homozygous for MTHFR mutation get clotting tests during pregnancy or any other test?
There are a series of thrombophilia workup. The topmost ones are factor V Leiden mutation, protein C resistance. The MTHFR gene the homozygous, like when both genes are affected, yes, it is at high risk. We monitor them very closely. Yes, they have high risk for blood clot formation. Yeah.
All
Yeah,
right.
pregnancy, you find out a lot about, I've seen people that have heart conditions that don't find out about until pregnancy. Same with a lot of blood clotting issues during pregnancy. So it's a lot of times it brings out things that we didn't even know about ourselves, unfortunately. But it's always better to err on the side of caution and yeah, and bring that up with your provider.
Provider. Yeah.
Yeah,
Absolutely. When in doubt, give your doctor a call.
yeah.
Exactly.
I have one more question from our audience, and thank you very much for tuning in and sharing these with us. This one comes from Nandini, who says, I heard about African American women having more issues during pregnancy than any other population. Could you please describe more about the differences in patient population based on your experience? I'll direct that to both of you.
Um, the risk factors, I mean, I would say it's, even across all races and a little bit more in African American population because of the propensity for high blood pressure. So more chances for a preeclampsia and gestational diabetes. I think it's even throughout. It's based on our genetic factors. Um, and a little bit more chances for bleeding from fibroids. So these are the factors we take into account when we are treating pregnant women.
And another question for the both of you. This is connected to the risk for pregnant and postpartum women. Um, are there women under-recognized or undertreated? And if so, could you share why? Why is that?
It's a very, very good question because women, we present with unusual symptoms, or even during pregnancy, if someone complains of headache or altered mental status, nausea, vomiting, generalized weakness, it's kind of brushed off as pregnancy symptoms and not paying more attention. When patients say, oh, this is not the usual headache I have, or this is not the usual fatigue or weakness I have. I can't even breathe when I'm sitting in a sitting position. So those are like the key things that should trigger a healthcare provider to uh, pay more attention. And then as healthcare providers, we don't see stroke that common, at least as an OBGYNs, we don't see stroke more common in younger women. So that comes last in our mind before the common conditions. And of course, we concentrate more on obstetric problems than the neurological symptoms. So that's one of the factors where it could get easily missed. And as women, we do seek care very late. We try to compensate or we try to adjust to the symptoms before we realize it's a serious symptom that we need to go to the provider. Want to add on any, Abby? Sorry.
Yeah, no, absolutely. In my talks with different hospitals across the state, that's one of the questions I pose to them. As I say, why are we missing about 50, why is there a delayed recognition in about 50% of our maternal strokes that we see? And that's really that's a nationwide statistic, not just Maryland, but I'm sure that we're just, a mini version of what we're seeing across the United States. And it's undoubtedly it's because we haven't talked about this before. We don't talk about this in nursing school for training our nurses. We don't talk about this, in medical school. It's not something that's focused on. So we're starting the conversation. We're talking about it, and we're talking about it in all of our hospitals. We're talking about it, for our EMS professionals. So we're really getting the conversation started, and I think that's going to help, chip away at the under recognition and the underdiagnosis of maternal stroke. But also, we're just not expecting it to happen, right? We're expecting pregnancy in the postpartum period for the high majority of the population goes okay. There's it's natural, it happens. And and everyone is usually okay. And we just get kind of in, not a complacent mindset, but we're not expecting strokes. We're not expecting this to see this. And so I think a lot of times as providers, we think of what is we don't jump to that conclusion, obviously. We're thinking, okay, what is this that we could rule out first? And that's just, our human nature. And then two, on the patient side of it, we think, especially, in mom brain, is to think, to explain it away for ourselves of what else could this be? I'm okay. I don't want to jump to conclusions. So really all of that comes together to really, cause a delay in recognition for this. So I think the big thing is to just bring awareness and be talking about it, that, both in the public and in the hospital setting of, just we want people to think about this. We want people to be aware of this and to think about getting our patient, to brain imaging quicker than maybe they would have not, they would have thought about before for this population. So
And there's also hesitation in using the standard stroke treatments because they're worried about the risk to the baby. But what we forget is we need to take care of mom for mom to take care of the baby. And it also involves multiple specialties like neurologists, OBGYN, sometimes even the neonatologist who takes care of the babies. So putting everyone or bringing everyone together again is as a delaying factor, especially when taking care of pregnant women.
exactly.
All right. And I think this is a very important question. We talked about those risk factors, the high likelihood of maternal stroke, depending on which population you're in. What should women do to reduce their risk factors for stroke? I'll start with Abby.
Yeah, absolutely. So right off the bat, we would identify if we've got any of those, if any of those health issues exist. So screening at your OBGYN visits for hypertension, for gestational diabetes, getting tested, getting seen, keeping your appointments throughout your pregnancy. That's your first line of defense. A healthy diet, everything that we know, you know, smoking cessation. If you can stop or reduce the amount of cigarette smoking you have or any other smoking, it's going to go a long way in helping prevent stroke. So really, just the healthy things we know to do that are easy to say and harder to do, really go a long way, as well as keeping your OB appointments, following up with any concerns you have with your OBGYN. Um, yeah, and we all know those things. But really it's going to help in the long run with your stroke risk.
And I also emphasize like making sure you're keeping your blood sugar, especially if you're diabetic or pre-diabetes. And I always recommend them 30 minutes of walk. Keep your heart rate at 120. You don't need to prove yourselves for anything. 30 minutes. That if you could do 30 minutes with lunch and dinner, perfect. But if you could just do 30 minutes of brisk walking, helps in a long way.
Yeah.
I think that's doable.
Right, right. And
Uh,
knowing the signs and symptoms, know your B fast, know your scan me, and last but not least, don't be afraid to speak up. Be a self advocate. 100%. Be a self advocate. Do not take no for an answer if you feel like something is really wrong.
Mhm. Absolutely. Absolutely. I have another audience question before we wrap up. I want to get a chance to answer Nandini's question. Um, what kind of support do you think there needs to be in furthering research or awareness about maternal stroke? Have either of you had a chance to study further with any organizations outside the U.S.? Or how does it compare here in the U.S. versus other places? Um, Care to elaborate a little bit more about what you think needs to be done to improve these conditions?
so not much aware, but I know like we are paying more and more attention to maternal stroke. graduated like 20 years ago. It wasn't even a factor, as Abby was said, it wasn't in med school, it wasn't in residency program. So we're talking more about it, and I'm talking more to my team members to be more aware, not to dismiss the symptoms. We are coaching our advanced practice providers, like our nurse practitioners, physician assistants, who sometimes would fill in us in seeing patients. So overall, like increasing the awareness, and we do have simulation drills. We have at MedStar. Every hospital has it. Sometimes it's every 2 months. Sometimes it's every 3 months. And we include it so not just the OB team, the entire hospital is aware when a women presents with a symptom, pregnant women or women. So there are more awareness among the healthcare providers as such, like everyone. Um, I think we need to do more presentations, more CMEs. It should be included in all the educational conferences, especially the OBGYNs or in the OBGYN field, to be more aware of stroke. Like emergency physicians are more aware of stroke symptoms treating. So we need to make more awareness among OBGYN or other field providers.
Yeah, absolutely. And as a state, I know, so I've actually presented at several stroke groups and as well as emergency department groups throughout the state. So we're really pushing. We're really pushing as a state. And I know the as a country, we're also doing the same at different, at different levels. But in our state, we're talking to all of our emergency providers and we're saying, okay, we've got this stroke population. And as a state, we're really good. We're really good at taking care of strokes. We need the maternal piece now. We need to be getting our OB, providers on board and including them in these conversations and talking about how we're going to be treating these patients timely and effectively because we're really good at stroke care as a state, and we just need that other piece of this for the maternal piece to make it more smooth.
That's good to know that that work is being done, and just the more awareness we have, the more likely we can address those issues head on. Speaking about that time piece, which I know is very critical to act quickly when you do see those warning signs for stroke. We have a question from Shirley. If caught on time, are the outcomes positive for maternal stroke?
Certainly, certainly, as it affects both lives, mom and baby. Very important. It's the timing of delivering the baby, stabilizing the mom, and reducing the risk factors. Like if it's an hemorrhagic stroke, it's very important to control the blood pressure to its normal level. And then the neurologist would look upon what other steps they could do to stabilize or improve the outcome.
Yep, absolutely. Yeah. So we know that we can replicate the positive outcomes that we have in the general population with the maternal population as well. We can absolutely, like I said, timely treatment. We see good outcomes. We absolutely do.
And same for for the thrombus, the blood clot stuff. Like it's very important to get that medication within the first 4 hours. So those, or even getting the imaging, as Abby said, like getting the CT scan, so we can figure out what stroke is happening and then start the treatment process. So we kind of reduce the spread of the stroke to vast portion of the brain. If small part is affected, then it's easy for the recovery. The weakness I was talking about, the swallowing difficulties, everything would be could recover much faster.
Okay, awesome. And then I have one last audience question from Nandini, talking about that additional training piece that we talked about that needs to occur more with maternal stroke and pinpointing that maternal a stroke. They're asking, do you use any AI tools, simulation, training tools, anything like that for health professionals to, get that added awareness and education that's needed for maternal stroke?
As I mentioned, with MedStar, we have the simulation drills. We have the mannequin. I mean, the mannequin could talk, could answer me if I ask questions. Are you bleeding or are you having weakness? It will tell me, and it's kind of like a real event. Like the patient presents with the a problem. Of course, it's a mannequin, but very, very similar to the real life. And then how we treat it, we time it, we see who we call, how they respond, how much time it takes. So everything. It's a very it's when we have that most, it's called MedStar obstetric simulation training. We all are like on our toes. So very, very intense simulation training.
That's great. That's good to hear. So as we close, I'd like to ask the both of you, what's your takeaway message for our audience today? What do you want them to take away the most from our Facebook Live today?
Don't dismiss the symptoms, recognize the symptoms, very important to diagnose and treat, and call 911. Don't drive yourselves, don't ask someone else to drive. Very important that the paramedics can get to you on time and start the treatment. I'll give it to Abby.
Yeah, absolutely. I echo that. And then also to be a self-advocate, to be a self-advocate and don't dismiss anything that is funky. Go follow your gut. You are a mom and you know what's normal and what's not with your body. And if it feels wrong, go see somebody.
And healthy lifestyle.
Yes, that too.
Also very important. Thank you very much. All very, very good information. I'm taking mental notes as we speak for this second pregnancy of mine. I really appreciate all this information. And let's keep that in mind. Healthy lifestyle, time is of the essence, and know those signs and symptoms for stroke. We want to thank you for tuning in today. Special thanks to Dr. Jayaraj and Abby for sharing your expertise and insights on this incredibly important topic. We hope this conversation helped raise awareness for you about maternal stroke and all the risk factors and steps that women and their care teams can take to recognize those warning signs and manage risk factors and act fast in an emergency. Remember, knowing the signs of stroke can save lives. So be fast. So balance eyes, face, arms, speech, and time is a helpful way to remember when to seek help immediately. If you have any questions, let's continue that conversation in the comments. Feel free to share those below, and we'll address as many as we can. If you're in the DC area and want to speak with a neurological specialist or neurologist about stroke prevention or treatment, please call us at 202-877-5026. We're going to add that information in the comments as well. Thanks again for watching, and share this video, and we hope you have a great day. Thanks.
Have a great day. Thank you.
Thanks.